what it looks like if you become a patient of CrossFit Precision Care. So right now there is a landing page, care.crossfit.com. That's where anybody can go to join the wait list. We are starting a beta of this practice in a couple of weeks. So end of October is when we'll start accepting patients into the practice off of that wait list. So when your turn comes, you'll get a code that you can then use to enroll as a patient in the practice. And right now, again, this is a beta version. We're anticipating learning a lot from the community. The great thing about the CrossFit community is that people are excited and willing to give feedback. And so we're excited about that and are certainly open to it and not married to our current approach of where we're starting. Where Wild Health has their current approach. It's working well for them, but we recognize the CrossFit community is unique, and we really want to use this to create something that is supportive of the community and that is in works synergistically with what's already happening, and they feel it. So they'll get their code. You'll be able to sign up as a patient. You'll choose a plan based on what your needs are. There's 3 different plans. The plans differ just in the frequency of visits that you want with your doctor and your health coach. And those that really just depends. So if you're somebody like you said, Fern, maybe I just want a really extensive look at my health once a year. I want to be able to look at all these labs and see where I'm doing. That's great. Maybe you do the low tier plan where you do one visit a year with your doctor. If you're someone who maybe has some chronic diseases and you've got a lot of upfront work to do and you may want more extensive testing, you may want to do more frequent visits, at least upfront. So then once you've chosen your plan, then you'll do an extensive lab panel. So you can get that done at any local laboratory like a LabCorp or a Quest. You'll have a DNA kit. So that'll be sent to your house. You'll submit a saliva sample, mail that back in. In the meantime, you'll be paired with a physician and a health coach who both do CrossFit. You'll do an initial intake call with your health coach. Before that, you'll fill out an extensive questionnaire. This is on all of your family history, your medical history, any medication, supplements, what your goals are, what your current, performance numbers look like, all kinds of stuff. We want to know anything and everything about you that's going to impact your health. You'll do an initial call with your health coach just to sort of get to know them, to understand, again, what your specific goals are and clarify any information from those questionnaires. And then once all your data comes back, so lab data, DNA data, questionnaire data, you'll sit down and you'll have an initial visit with both your doctor and your health coach. So all 3 of you in that same conversation. And this is really the opportunity to sit down and really get to know you and to understand, okay, what your specific goals are. I think for every single one of us, we look at this in the gym too. It's like, what are my goals? Do I want to train to go to the games? Do I want to train to be able to play with my kids? Do I want to train to be able to, I'm going on a big hike next year. What is it that's really important to you? It's different for everybody. And so we want to make sure that we're aligning our care with what your goals are. So we'll have that conversation, and then we'll put all this data together to try to determine, okay, what are the things that we can do for your health that are going to have the biggest impact in moving you towards that goal. So for example, we'll go through, nutrition, sleep recovery, mindfulness, disease risk, like cardiovascular disease risk, Alzheimer's risk, insulin resistance, inflammation. There's a whole detailed report that pulls in all of the information, like your genetics, your labs, your questionnaire data to help customize our recommendations for each of those areas. And then us as a team are going to sit down and say, okay, here's your goals. Here are probably the top 3 recommendations that are going to have the biggest impact. And then here are the objective markers that we're going to track so that we know if we're moving towards those goals. So say, for example, you come in and, your goal is really, I've got a lot of heart disease in my family. My parents had a heart attack. My dad had a heart attack when he was in his 50s. I really want to be around for my grandkids. I want to make sure that I'm minimizing, my chances of having a heart attack. So we look at your report and we realize, wow, you've got some pre-diabetes. So even though, you're doing a lot of things great, we still are having some insulin resistance. So let's actually take a look at, what your genetics are telling us, the fact that you've got insulin resistance showing on your labs, and let's make an educated plan about how we're going to reduce that. Maybe it means, you're only sleeping 4 hours a night. That can be a huge driver of insulin resistance. Let's focus on optimizing your sleep. And then let's recheck your insulin resistance markers in 3 months and see if we're moving in the right direction. And if not, then let's figure out what our next move is going to be. And so then the ongoing care really looks like iterating on that plan. Whether it's you achieve a goal that you'd set and you want to work on something else, or taking steps to further move you towards those goals, and then addressing any other one-off needs that come up. So maybe you get sick, maybe you have a UTI and you need some help. Those are also things that we can address.